Echinacea, which is very famous. Lots and lots of research done on echinacea. Echinacea, I think it was 2010 research, where echinacea was shown to be as effective or more effective than Tamiflu for treatment of the swine flu. So echinacea, though, doesn't have a true antiviral effect like olive leaf does, for example. It doesn't prevent the viruses from entering the cell. It has an antiviral effect, but through a different mechanism that isn't completely understood. But nonetheless, it has a very powerful immune-enhancing and antiviral, antibacterial effect. It's also very good for your lymphatic system. It helps to cleanse and detoxify the body through the lymphatic system. So with regards to the research with echinacea, in a randomized, double-blind, placebo-controlled trial. Now this is a type of trial that doctors like because they have a control group, and this is what they class as research. So in this type of study, 180 patients with upper respiratory tract infection received the equivalent of 1,800 milligrams per day or 900 milligrams per day of Echinacea purpurea root in a tincture. So either in a dried material with a higher dose or a lower dose in a tincture, a liquid extract, or a placebo, which is basically some kind of sugar, basically not echinacea, some kind of inert substance. Patients receiving the higher dose experienced significant relief of symptoms. So this shows that it's also dose dependent. The patients taking the 1,800 milligrams recovered faster than the patients taking the 900 milligrams. Now this is really important because strength that is allowed on the off-the-shelf products to, I believe, about 400 milligrams. So that clearly shows that you need to take a lot more of that product to get close to what the research showed, which was 1,800 milligrams, which is the more therapeutic dose. And also with echinacea, it's very important that you take it on an empty stomach, not after you eat, because the polysaccharides, the immune-enhancing compounds, anti-inflammatory compounds, will not be absorbed properly if you take it after food. And it works better if you take small doses regularly through the day, as opposed to one large dose, and that would be more effective.